Good morning. My name is Stacy Altori, owner-operator of ProMed Billing Solutions. We have been in business for over 24 years with a staff of 30 billers, specializing in one of our specialties is the wound care space. And you will see exactly how knowledgeable we are in the top 5 questions today with wound care billing. I'd like to introduce Jeff Paprzycki, who is my wound care billing specialist, and also the VP of ProMed Billing Solutions.
Thank you.
So let's start off with question number 1. What is the biggest reason that prevents payment for a skin substitution?
Well, I would have to say improper information on the claim form that you submit to the insurance. And some of those examples can include, number one, improper credentialing. If you don't have a good enrollment record with, say, Medicare at 855B, and making sure that your providers are linked to your practice, you're just simply not going to get paid. And you also have to make sure if you have an approved enrollment record, what is the effective date? We have had instances where providers come on board to ProMed and they can't get their claims to pay. And some of the time we find because they have improper credentialing and they may have an approved enrollment record, but they don't look at their effective date with Medicare. And maybe they placed a skin substitute before that date. So these are the things you have to look at with credentialing for information on your claim that can cause a denial. Once you get past that part, then you got to look at patient information not being correct. So this can include the ID numbers, the dates of birth, the patient name. So the patient name has to be exactly as it is, be entered exactly as it is, as what's on the patient ID card from said insurance. And that next thing you have to look at is improper coding. What are you coding? Are the proper modifiers on those codes? And are you diagnosis pointing to the correct codes that you're billing? Some of those, if you don't get it right, you are definitely not going to get paid from any insurance, especially Medicare. And there's also other information that may not be correct in other areas of the claim form, such as box 32. Where is the patient being treated? Do you have the patient guarantor in there? You may have little intricacies like in Medicare for first coast service options. They would like box 15 populated. So you always have to check your MAC and your insurance's, commercial insurance's guidance to make sure you place the correct information on the HCFA form that you submit to the insurance. So if billed correctly, Medicare will process your claims correctly, and other insurances will process your claims based on a verification to see if an authorization or pre-certification is needed or not. This is a must-have for commercial insurances. For Medicare, they will most likely process your pay your claims if you submit them correctly, but you just have to ensure that all your documentation is perfect for future audits.
Thank you, Jeff.
Mm-hmm.
What types of services can be performed during the standard care period of 30 days?
So as we all know, you're going to have two types of wounds for patients. They're going to be acute and they're going to be chronic. So acute wounds are going to heal much faster than the chronic wounds. However, here are a few examples of billable services that could be applied to either types of wounds. But note, not all commercial carriers will pay some of the services that are mentioned below. This is done through a patient verification of benefits, which ProMed can help out with. Number one, your wound assessment, which will be part of your E&M coding. Number two, swabbing for infections. Number three, cleaning and dressing changes. Number four, wound debridements of many types. Number five, which is, in my opinion, one of the most important, patient education. which will include the patient diet and if the patient is smoking. And if you give the patient a smoking cessation, that can be billed in a separate code, which is 99406 and 99407, both of which are timed codes. Number 6, monitoring of wound healing, which will be part of your E&M coding. Number 7, ultramist therapy provided by Sanuwave, which can effectively treat venous leg ulcers, diabetic leg ulcers, deep tissue pressure injuries, surgical wounds, etc. And it reimburses very well by Medicare. Number 8, detecting bacteria and measuring a wound area with equipment such as Moleculite. And Moleculite may reimburse very well with Medicare depending on your MAC location. And in my opinion, Moleculite is one of the top things to have in your documentation to ensure, to tell Medicare or any commercial carrier that there's no bacteria in the wound and that the wound area has been measured perfectly. And number 9, you can even get yourself set up under Medicare DME and administered lymphedema pumps. So those are some of the examples that you can do with standard of care. There's much more to it. Contact ProMed Billing Solutions for more information.
Thank you, Jeff. What are the CMS policies on placement of a skin substitute in regards to billing?
Well, the first question you have to ask yourself is, 1, when you're using a skin substitute in accordance with FDA indications and guidelines, you want to make sure you ask your distributor or manufacturer to provide you with the latest FDA clearance for their products. And this means asking them, where is your Section 361 approval or Section 351 approval? And of course, I can be available to answer and clarify this question. Number 2, the billing must accurately reflect the specific code for the skin substitute and the application procedure. You can always get the specific code that is to be billed from your distributor or manufacturer, or ProMed can help you out finding those codes and the CMS guidelines that come with those codes. Number 3, your proper review of documentation. This must be done prior to billing to ensure all verbiage needed for the skin substitute is in your documentation. For example, what was the serial number of that skin substitute? What was the lot number? What was the expiration date? Was the product fenestrated? In addition, how much was used? How much was wasted? If there was waste, you have to document that. Some people that we've come across, some clients that we've come across, they don't document how much waste there was. Well, you can get reimbursed for that waste. So you have to document it, and we bill it on a separate line than your normal code, such as Q4175. So I'm going to bill Q4175 on one line. The next line is going to have Q4175 with waste, and both the line items will process correctly through Medicare and or your local commercial carriers. So once you determine how much, where was the applications to the wounds? This is very important. Your patients may have 1 wound. They may have 20 wounds. You have to make sure you document if there were multiple wounds and making sure that the amount is placed on those specific wounds correctly. This all must be documented. And I even recommend taking pictures of the boxes and including them into your documentation. But using a great wound care software is a key to your success. Using any rudimentary software out there, most of them that are out there cannot handle wound care. And that is something you really want to be specific and look for. And ProMed can help you out with that. Just give us a call. Number 5, for Medicare, we at ProMed continuously check the national and local MAC guidelines for updated guidance on skin substitutes. For commercial plans, you want to always check their guidance on the skin substitutes. As you're going to find right now, most of them are not covered at this time due to being experimental and or another reason.
Jeff, could you just be a little more specific on how often these guidelines or policies should be checked?
Absolutely. At least on a monthly basis. Medicare may or may not update their local or national guidelines on a monthly or quarterly basis. So you want to make sure on the first of every month that you're going on and making sure that your current skin substitute that you're placing is in guidance with Medicare and or your commercial carriers.
Question 4, how do you interpret Medicare fee schedules versus how you actually get paid for skin substitute?
Okay, the first thing you want to do is find your local MAC fee schedule. For example, if you are in Florida, you can go to First Coast Service Options and you can pull their Medicare Part B fee schedule. And you're going to look for both the ASP and the MPFS fee schedules. ASP stands for average sales price. MPFS means Medicare physician fee schedules. Now, this is going to depend on the skin, if the skin sub is a Q code or an A code. If it is a Q code, it's going to end up on the ASP fee schedule, average sales price. And that is going to be the fee schedule you're going to get per square centimeter. If it's an A code, it's most likely going to be on the MPFS fee schedule. And that fee schedule stores your regular exams, your x-rays and whatnot, but is also going to include the A codes. Now, the difference between the two, the Q codes are reimbursed at 100% of the allowed amount for both a nurse practitioner and an MD. For an A code, because it's on the MPFS fee schedule, they're going to take a 15% reduction for nurse practitioners. The MD gets 100% of that fee schedule. So the other thing you have to look at is sequestration reduction of about 2%. The term sequestration stands for mandatory payment reductions in the Medicare fee-for-service program, as per the Budget Control Act of 2011. And it's not going away anytime soon, so you could take an additional 2% off both the ASP and the MPFS fee schedules. Then you're going to look at getting paid from Medicare 80% of the allowed amount, because that's the standard for every single Medicare Part B patient. The final 20% will be either a patient supplement, a true secondary, or patient responsibility. Now, what I mean between the three is a supplement only covers what Medicare allows. So any non-covered services or denied services will not be covered by the supplement, but they're required to pay based on the Medicare's allowed amounts that they pay you. A true secondary, what I like to call, acts as a primary, but you have to be careful with those because they may or may not require an authorization or pre-certification. Or it's going to be patient responsibility, and then you have to bill the patient. So it's a rule under Medicare that you must make a reasonable attempt to collect the debt. If you have any issues or questions on this fee schedule or everything that I just said, please contact ProMed Billing Solutions today so we can guide you through it.
Thank you for that. Question number 5. What are some points that are needed in documentation to justify the skin substitute that is being placed?
Well, there are many different points, and I do have a list for Medicare LCD guidelines, which you can contact ProMed today to get. But a few examples of essential documentation includes, number 1, a detailed description of the wound, including the size, depth, and location of that wound or wounds. Like I said, you could have one wound, you could have 20 wounds, but you have to give 20 different explanations if you have 20 different wounds, right? You have to think of it along the lines of an auditor. So when you do get audited by Medicare, what you're doing is you're telling a story. Their auditors don't know, they don't know all the verbiage that you're doing, but they do look for keywords. And ProMed can help you out with some of those keywords in your documentation. So you're telling a story, you're telling a short story to everybody that is listening every single time. Because you get paid good money for what you're doing, you have to spend the extra time, unlike your normal documentation, say that you would do an exam and a normal procedure that's outside of a skin substitute. Take the time to be very descriptive on your notes. Number two, previous treatments tried and the outcomes indicating why standard of care is not sufficient. If you do not document this, and this can include pulling documentation from, say, example, a home health agency, and they've been trying to, or, an alpha or a SNP, and they've been trying to perform standard of care for a patient, which is probably why they called you, because you're providing advanced modalities. So you have to come in there, you pull that documentation into your documentation. Make sure what they were doing would actually meet the standard for standard of care. And then you can include that into your 30 days of standard of care before you place a skin substitute. Number three, medical necessity for the skin substitute. You got to link it to the patient's condition and explain the expected benefit. This is super important that you do this, because Medicare looks at it as they're spending a lot of money for you to place a graft. So you have to really justify it. We have to drive that home every single time. Number four, the specifics of the skin substitute used, including the name, the size, the application site. And like I said, again, you want to use certain things into your documentation. So if you place a skin substitute, we highly recommend you take a picture of the boxes that you open and put that into the patient's documentation. That could be really important for an audit, because what Medicare looks for simply is fraud. And if you're placing a skin substitute and you put that exact box that's in your documentation, nobody can ever accuse you of that. So you're backing yourself up. And this is something that I see industry-wide that people are just not doing. So, and that brings me to number five, which is your procedure notes, including the date, preparation, and your application techniques. Number six, you have a follow-up care plan and expected healing outcomes. Again, we're coming to our short story. This is where you're going to end your short story, right? So you're telling a narrative, but you got to have an end to your story. And that would be your follow-up care plans and expected healing outcomes.
Thank you for that, Jeff. That was very detailed there. So for the last question, I just wanted to have you elaborate a little bit on HIPAA and OIG programs for offices that are just starting up a wound care facility or clinic. So I just wanted to touch base on that real quick, Jeff, because I know that you're very big on HIPAA and OIG. So
yes.
Just
well, as you know, I am a HIPAA compliance officer. So it is very important to have a HIPAA and OIG program in your office. And what we found here at ProMed is most, if not all, of our clients really do not have a proper HIPAA and or OIG compliance program in place. And this really should be the standard for everybody, because again, you're going back to, we're getting paid good amount of money from Medicare to place skin substitutes, but we want to follow all the federal guidelines. And yes, healthcare providers are all required to have a HIPAA and OIG program in place. And this is not something that you can just buy off the shelf. This is a marathon. It's not a race. It's not something you can quickly buy and just throw on your shelf and be done with it. No, it is a living, breathing document. It is, like I said, it is a marathon that you continuously update a HIPAA and OIG provider manual, right? And the difference, a HIPAA is a compliance program to protect patient information and ensure privacy. So training is very critical for your office staff to make sure no patient data is compromised. And an OIG program is also required to prevent fraud, waste, and abuse. These programs help ensure adherence to federal regulations and reduce the risk of legal penalties. And so they typically include policies, training, audits, and reporting mechanisms to ensure ongoing compliance. And what I mean by that is having a HIPAA and OIG physical book on your shelf, having one digitally. Notice I said audits, right? So audits, do you internally audit your documentation to ensure that your documentation is always ironclad for Medicare and or other insurances that may request an audit? Training for the staff, which is really critical, because the staff sometimes they're just not going to know the intricacies. And so in order to protect patient data and make sure that you are federally compliant, having that training for your employees, at least on a quarterly basis, is critical. And you want to ensure compliance all the way around, from your documentation, from the time really that you see the patient, documentation, to the end of the day, and make sure you record everything that happened, any instances that happen where, you know, data might be compromised, right? So if it's compromised, it somehow happens, and it does happen. You see it every day through other entities, T-Mobile, whoever, that has data breaches. Well, the difference between you that has a manual and someone that doesn't have a manual is all about intent. So if you're intending to do the right thing, the penalties would be way less than somebody who knows they're supposed to do it and then they don't do it. That is the biggest thing. So at the end of the day, at ProMed Billing Solutions, we are committed to revolutionizing wound care billing through our innovative techniques, ensuring each provider receives the best possible solutions. If you need more specific details or have additional questions, please contact ProMed Billing Solutions, a US-based company today, direct at 866-977-6633. Thank you.
So thank you, Jeff, for answering those 5 top questions on billing. Thank you, everyone, for joining us today. If you have any additional questions, we are here for you. As Jeff stated, our number is 866-977-6633, or you can reach me directly at stacy@promedclaims.com. Thank you very much for joining us today, and we look forward to hearing from you. And please stay tuned for a message from Dr. Ali Saberi. Thank you.
My name is Dr. Ali Saberi. I'm a internal medicine doc and professional wound care specialist for 9 years now. And I've been using ProMed Billing Solutions for a few years for the billing of wound care specifically, and have really nothing but positive things to say about them. They have excellent communication and customer service. They know what they're doing with the wound care setting, because that is a tricky setting, and so you want to make sure you have someone that understands the intricacies of wound care billing, and definitely ProMed Billing Solutions has those intricacies and understands what to do with the billing nuances regarding wound care. So I do highly recommend them for your billing needs.